Hello everyone. Once again, welcome to the Smart RN channel. My name is Henry. Today, we continue with our series on chronic kidney disease. In our previous video, we looked at chronic kidney disease and we considered the definition, the risk factors, the stages, as well as the clinical manifestations of chronic kidney disease. In this video today, we are going to look at the diagnosis, the management, and even the nursing interventions when you care for those patients with chronic kidney disease. So let's get started. Now, chronic kidney disease or CKD can be diagnosed in a number of ways. One, we have got urinalysis. In urinalysis, a urine sample is going to be obtained and taken to the laboratory. In the laboratory, this urine sample is going to be investigated for hematuria, that means the presence of red blood cells in the urine, or glucosuria, the presence of glucose. It will be investigated for white blood cells and even proteinuria, the presence of protein. Now, if you remember very well, we said that the glomerulus is semi-permeable, but it can only allow smaller particles to pass through. So we do not expect to find blood cells or proteins in the glomerular filtrate. So if there are proteins or red blood cells in this urine sample, that's a pointer to the damage to the renal system, and this points to chronic kidney disease. So the presence of red blood cells and proteins in the urine is a great indicator of CKD. Then we have got creatinine and BUN levels. Creatinine, as we said, is the best indicator of kidney function. So if the levels of creatinine in our bloodstream are elevated, then that points to a problem. Now, if this creatinine and BUN levels are elevated and gradually increase over a long time, then this indicates progressive kidney failure, which is CKD. Then we have got complete blood count or CBC. Now, in CBC, we are paying great attention to hemoglobin and the hematocrit. Remember, the kidneys are not producing erythropoietin, so there is no stimulation of red blood cell formation. So this will have an effect on the hemoglobin and the hematocrit levels of blood. So we are looking at the CBC levels with great attention to these hemoglobin and even the hematocrit. We also use imaging studies to identify or to diagnose CKD. We have renal ultrasound, we have CT scans, cystoscopy, retrograde pyelography. All these are methods that can be used to study or to look at our renal system and be able to identify any structural changes that could be causing chronic kidney disease. When it comes to management, we have a number of ways in which we manage CKD. And one of the most commonly used method or way to manage chronic kidney disease is what we refer to as renal replacement therapies. Just from the word renal replacement, these are methods which are used to replace or to replicate the kidney function. Now, the most common way of renal replacement therapy is dialysis. Dialysis is where the blood is moved out of the patient, passed through a special filter to remove or to filter out the impurities, and then the blood is directed back into the patient. So dialysis is one of the most commonly used renal replacement therapy. And we have got two forms of dialysis. We have got hemodialysis and peritoneal dialysis. All these are methods that we can use to remove impurities from the blood of this particular patient. So you realize that CKD patients normally undergo dialysis either once a week or twice a week or even 3 times a week. We even have urgent hemodialysis, whereby there is a volume overload that requires urgent dialysis for that particular patient. And then number two, we normally treat the signs and symptoms. So all the signs and symptoms which are associated with CKD are normally treated as we care for these particular patients. For example, elevated levels of potassium, decreased levels of calcium, elevated levels of phosphates, edema, anemia. All those are signs and symptoms that are present in this particular patient. So we normally treat those particular signs and symptoms as we help this particular CKD patient. Then we have renal transplant. These patients can undergo renal transplant so that they can be able to deal with this problem of CKD. Now, when it comes to nursing interventions, there are a number of things that nurses do when they are caring for these patients. Now, number one, assessment. This is the major thing that nurses normally preoccupy themselves with. So we are assessing vital signs of this particular patient. For example, the blood pressure. Remember, it is going to be elevated because of volume overload. Most of the CKD patients, if you look at the blood pressures, they are normally very high. Then we have got increased heart rates. We are also looking at the oxygen saturation, because many times these patients are experiencing shortness of breath. So we are paying close attention to that particular O2 saturation. We assess edema. The patients are swollen in the ankles, in the legs, in the faces. So we assess that particular edema to see if our interventions are actually bearing any fruit. They also have neck vein distension. Due to volume overload, you find that the veins in the necks are distended because there is high volume of fluid in their system. So those are the assessments that nurses carry out. Number two, nurses monitor lab values. You are keeping an eye on the lab values of this patient. When lab draws are done, when urine is actually obtained and taken to the laboratory, you always look at the result just to see if the intervention methods are actually bearing any fruit. So we look at the BUN levels, we look at the creatinine levels, and again I repeat, creatinine is the best indicator of kidney function. We look at this potassium. Remember, elevated levels of potassium are very dangerous to our bodies, and especially on the cardiac system. So we pay close attention to elevated levels of potassium so that we put in intervention to bring the levels down when caring for these particular patients. We also look at the sodium and even calcium levels. Now, another thing that nurses do is that they monitor the vascular access site. Remember, these patients are undergoing dialysis. So they are going to have either the arteriovenous fistulas in their arms, or they may have permacath, which are normally in the internal jugular veins, or those undergoing peritoneal dialysis, they are going to have a dialysis site in their abdomen. So why are we paying close attention to this site? These sites are entry points. They can be entry points of infection, and that can be very, very disastrous to this particular patient. Remember, this AVF and this permacath, they are going directly into their bloodstream. So we are monitoring these sites just to be able to prevent any infection, to notice if there is any infection or if there is any problem associated with those particular sites. So we keep an eye on these sites just to ensure that they are clean and they are managed well to prevent this particular infection. Now we also we monitor their daily weights. We take the weights of these patients, and especially in the mornings, using the same scale, using the same clothing. So we monitor the daily weights because fluid normally elevates or causes weight to be gained in this particular patient. So we are monitoring their weight to see if there is any changes occurring as we carry out our intervention. There is always fluid restrictions in these patients. So we make sure that we adhere to these fluid restriction. So most of the time, these patients are restricted maybe to 1 liter or 1.5 liters or 2 liters of fluid per day. So we monitor the input and output. How much are they taking in? How much are they taking out? Just to ensure that we do not have a continuous accumulation of fluid in this particular patient. So we restrict fluid intake, and we strictly monitor the input and output from this particular patient. There are dietary restrictions that that nurses make sure are adhered to. These patients are going to have dietary restrictions. They will be on a renal diet most of the time, and this will be a diet of maybe their decreased proteins, their decreased potassium diet. So we monitor this diet to make sure that we adhere to the diet which has been prescribed by the prescribers. And then we administer the medication. These patients have good medication. We are going to administer, for example, diuretics, which are going to help clear the fluid from their bodies. And we have got elevated blood pressures. They have also have got blood pressure medication. We administer all medications and on time as prescribed by the prescriber. We also provide skin care. These patients might have a dry skin because of this impurities in the blood. So we care for their skin, maybe to apply to moisturize the skin to ensure that the patients are comfortable. And then we provide teaching both to the patient and even to their families. We teach them about the signs and symptoms of CKD, the diet and medication adherence, fluid restriction, weight monitoring, smoking cessation if they are smokers. That's very important. We teach them how to monitor their blood pressure, and we also advise them to seek medical treatment when the signs and symptoms of CKD are evident in their body. We also encourage them to exercise and rest, as that is a very, very great way, a very, very great therapeutic way. So these are the things that we teach these particular CKD patients, both the patients and even their families. So that brings us to the end of this video. As always, drop a comment, like the video, share the video, and if you are not a subscriber to the Smart RN channel, I request you to subscribe today. From me here, it is a goodbye.